Hello, Dr. James Bogash, expert in health and longevity, and this is a particularly interesting study. Basically, we spend a lot of time on estimating who's going to have a heart attack. There are different markers. There's things like the atherosclerotic cardiovascular disease risk estimator plus. There is the prevent guidelines. All of these are deciding who might have a heart attack. I'll get into some of that, like what that really means from a medical standpoint in just a minute. Before I go into this though, make sure you like this video, share it with somebody who you think needs information, and subscribe to the channel. So that being said, this was a very interesting study, and they weren't looking at somebody's estimate of whether they're going to have a heart attack. They looked at people who had a heart attack, and 2 days prior, where would they have been put at risk-wise? So how good are our estimates based on real-world outcomes, not guesses? This is actually looking back and seeing how accurate we were. This was a study looking at 465 people who had a heart attack who had no prior cardiovascular disease or no prior episodes or diagnosis, under 65 years of age, so this was a younger clientele. And the ASCVD risk estimator plus, so the atherosclerotic cardiovascular risk or cardiovascular disease risk estimator plus, takes into account things like age, sex, race, blood pressure, lipids, diabetes, and whether you're a smoker. And it turned out that of the people who had a heart attack, about 45% of them would have been considered low or borderline. We're almost half the people we would have completely missed. And then if you use the prevent guidelines, which also took into account BMI and the A1C levels, and there was something else they took into, but maybe adding in a couple more blood markers, it turned out that 61% of them were lower or borderline. So, in other words, these things suck. Also, 60% of the people, of these 465 people, did not have any symptoms prior to their heart attack, so it kind of came out of nowhere. The authors suggest maybe we could add in like CTC scoring, so cardiovascular, CT, like computerized tomography, cardiovascular screening, or calcium screening, and could we add that in? But we're missing the bigger point in that these guidelines are always looking for where can we medicate? Oh, you're at increased risk, you should take a statin. Or your blood pressure's up, you should take blood pressure medication, something to bring it down. None of this is ever really talking about lifestyle, because nobody ever dies from taking better care of themselves. I mean, ultimately you will, but until we look at the overall lifestyle, so looking closely at the diet, exactly what they're eating, and exercise, I think that the research heavily weighs towards short burst exercise. This whole walking around the block for 30 minutes, it's not going to cut it. You can look at somebody and get a very good risk of their cardiovascular disease risk looking at everything, not just labs, but their lifestyle. And we don't do that when we're risking. We looked at these different markers. We don't look at diet. We don't look at, like, maybe these markers don't look at whether somebody's exercising, which is crazy. This is why cardiovascular disease remains the #1 killer, because we're still asking the wrong questions. We're still suggesting people make risks based on their future estimate, and nobody really cares if they're going to have a heart attack in 20 years or 10. It's usually, they're almost always 10-year risk markers. Until we start coming to grips with how much diet and exercise, specifically short burst, play a role in cardiovascular disease prevention above and beyond everything else, cardiovascular disease will remain the #1 killer. So I've certainly, even just the American Heart Association's Life's Essential 8 is is a good marker. I think they should clean up the diet aspect of it and the exercise component of it, but it's a really good checkbox list to see where you're at as far as heart disease risk. As always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel.